RADIANCE-HTN TRIO trial was a trial to look at renal denervation versus a sham procedure and to determine whether renal denervation could actually lower blood pressure from baseline to 2 months after treating with renal denervation versus a sham. The idea of this trial was to enroll patients that had difficult to treat blood pressure. In other words, patients had blood pressures of 160 or more despite being on 4 medications at screening. They were then placed on a single drug pill, actually 3 drugs in a single pill, combination therapy to regularize treatment across both study arms, and stayed on that for 4 weeks, then determined to see if their blood pressure was still elevated, and if so, they were randomized to denervation versus sham. What we found when we did this study is that at 2 months, there was a drop in blood pressure of 8 millimeters of mercury seen in the renal denervation arm and 3 millimeters of mercury in the sham arm. So the difference, 4.5 millimeters median difference, was actually in favor of renal denervation versus sham. We observed similar drops in 24-hour blood pressure, nighttime blood pressure, and office blood pressure as well, suggesting that this effect was seen throughout the circadian rhythm. In terms of adverse side effects, they were very low in this study. There were only 136 patients randomized. This will be followed for longer periods of time, though we didn't appreciate any differences between the two study arms in terms of adverse effects. Notably, though, there were more patients in whom medications need to be reinstituted in the sham arm compared to the denervation arm, again, perhaps speaking to the efficacy. At present, renal denervation is not approved, certainly here in the United States, and so these findings are preliminary. We need longer term follow-up both for efficacy and for safety. But what I think is exciting about these data is that they do show that for patients that have difficult to treat blood pressure, despite being on good medical therapy, there may be an option for these patients to treat them with a device that can then therefore lower their blood pressure. In this trial program, we're going to be following patients out to a total of 5 years. There are additionally data on renal denervation with longer term follow-up. And what's important there is not only to look at efficacy over time, but also safety, but also more importantly, in some respects, can you ameliorate or mitigate a deterioration of renal function, other clinical events over time? That's really the promise for therapies like this. For blood pressure control, for the most part, we're talking about prevention of longer term events. And so ultimately, that will be the holy grail of a therapy like this.